Hello, and welcome to 30 Minutes. I'm Rick Anthony. Since its passage in 2010, the Affordable Care Act, commonly known as Obamacare, has bemused and befuddled politicians, healthcare professionals, and the very people it was ostensibly designed to benefit. Among the thousands of pages of the law and what I believe are oppressive regulations are the terms and conditions of a brand new program that is changing, transforming healthcare in this country, a system that has served us well for generations and has been the envy of the world. Even though it may be the most expensive healthcare on the planet, it is still the best healthcare on the planet, or at least has been. Regardless of how you may feel about Obamacare, I think you'll be interested in the impartial, objective reporting of the data that you'll be hearing today from my guest, who is a strategy consultant with extensive experience in healthcare, who will be helping us understand what's in that pile of paper, what we can look forward to, and some of the implications and benefits of the new legislation. John Reiff, welcome to 30 Minutes.
Nice to see you again.
John is a good friend, has been with us before on some other healthcare-related topics, particularly in the area of disability, which is one of your subspecialties. John, I know you have poured over all of the paper.
All 2,900 pages?
2,700 plus
pages,
the regulations that are still being written and promulgated. And we promise not to take sides on this, or at least you promised. I'm not sure I can restrain myself.
Okay, I get that.
Because well, I agree. And as I said, it's not political. It's not Democrat versus or conservative versus liberal or whatever. It's the ideology. It's what this program represents to this country and our culture. Put that aside, however, for our purposes, and let's see if we can, with your help, learn more about what's in the bill, what's important to all of us in the bill, and from the data you have, why we should be looking at this as something that in the long run may be the best thing that could happen, since everyone agrees the healthcare system in this country has to be transformed.
Well, it does. It really has to be. We have so many issues to deal with, and hopefully we'll get through most of them. Right at this particular time, the gross domestic product is one of the key issues that we have to look at. We spend 16.5% of the gross domestic product on health care in this country. And that's one out of every $6. And we're estimating that by the year 2015, it will probably be somewhere around 21% of the gross domestic product, be one out of every $5. Well, this might not be sustainable, but from what we're seeing, it could be helpful if we can adjust and take care of some of the people who need care and who aren't getting care. We just went through a recession, and healthcare costs moderately dropped, and it dropped because of a couple of things. People on Medicare, as an example, saved $750 per person on Medicare, averaging out, because of the transference of pharmaceuticals to their generic equivalency and things of that sort. And we also had some things done for people who didn't take those precautions in the past, and they include such things as, I would say, females' problems that they have to be dealt with early, and they were driven in the Medicare bill and in the Medicaid bill to show those things, to make it available to people, and people took advantage of it. So there is some indication that we're starting to see people start to understand that they have to educate themselves and do a better job of this, or we're going to have real problems. We spend $800 billion of the $2.8 trillion we spend a year on Medicare and Medicaid. The Medicare program has been self-sustaining for a good long time. The Medicaid program is another issue.
For those who may not understand the difference, Medicare and Medicaid?
Medicare is the program that is funded through the Social Security Administration
Right.
and your deposits and my deposits over the year into the program to help pay for Medicare as we age in at 65 plus or somewhere around there. The Medicaid program is for people who are in poverty, or it's planned to affect people who are at 133% of the poverty level. And in addition to that, it's for people, and that's for husbands, wives, and children. It also is going to impact people who have disabilities issues, special needs, whether it be intellectual disabilities, autism, whether it be things like addictive diseases, behavioral disorders, and those unlike. So of the 5 in the state of Pennsylvania, there will be 542,000 people, supposedly, from a report that I just received the other day. There will be 30 million people coming into the system under this new program that will move us in the dollar figures that I indicated to you. And my concern, as it is your concern and everyone else's concern, how are we going to treat all these people?
Yes.
But they're not all going to go rushing to the hospital. They're not going to the doctor's office. But they're going to need some help. And a lot of things are happening that might impact that, including how do we treat people who say they're on Medicaid, who used to go to the emergency ward. Now they're going to come through the front door, and hopefully they're going to be met by a nurse practitioner who's going to be able to do a couple things. And she's going to say, Anthony, I think really, Rick, we ought to put for you a prescription. You don't really have to be here. Here, take this and go get that taken care of. That cold, it really sounds bad, but we think it may be taken care of. Or I come through and I look like I really need a doctor, and sometimes I look like that. And I end up going, she ends up directing me to one of the physicians in the hospitals. How does this all impact us here? This is the healthcare capital of the country. I mean, we have more of everything you can think of than anybody else in the country. We have 5 medical school hospitals. We have CHOP, the Children's Hospital of Philadelphia. That happens to be the premier children's hospital in the world, and it has said so by many, many people. And we're lucky to and fortunate to have a lot of these things. If there's a disease out there that has to be treated, we can find a specialist in the city of Philadelphia and out here on the main line, which is where we're talking from today, to take care of that problem. So it's extremely important that we understand we have people in place, but we don't have enough of them, and we have to build that base, has to be addressed. And I think some things are going to happen that will address it, and I think there will be some things that will energize the economy here too with this investment. And I think that's one of the reasons the Affordable Care Act was put in place to start with, was to try to infuse some additional dollars into the system. It's now 3 years old, as you pointed out. There are things that are being set up that have to be put in place first before we get to putting all the 30 million people that we're talking about. And in Pennsylvania and the Commonwealth, we'll be having 542,000 people getting into the system.
John, it all sounds great as you have just summarized it, pointing out some of the particularly beneficial aspects of the law, at least as intended. Why is it then that there is still, according to all the polls I've seen, a high percentage of people who don't want Obamacare, who don't understand Obamacare, and maybe that's the answer to the first question, and a lot of skepticism about whether or not the numbers that you and others have cited will actually materialize? Because on the one hand, we have all these goodies that are coming out. On the other hand, we don't have the capacity to pay for it all, to deliver all the services. You haven't touched yet on, but I'm sure you will, on technology. I may not be meeting with a nurse practitioner. I may be sitting in front of a screen, telemedicine, and my problem is being diagnosed remotely and treated remotely, which is where this has to go because we don't have the docs in place, the delivery systems in place. We just don't. And there's not enough time, nor is there enough incentive, at least from what I'm hearing. And you have specialists for every part of your body as well, I know you do, We have some of the same specialists. But they're all telling me, as I know they're telling you, they're overworked, they're overburdened, the system is grinding them down, and there aren't as many people going into medical school because you take on that huge burden and you don't have the opportunity not only to recoup the expense, but to make a good living for the time, the commitment, the dedication that you have to put into your practice.
There'll be nurse
It's very
practitioners
complicated.
and I think a number of other nurse-related
Yes.
categories that will be moving into the system that will be taking away from doctors some of the obligations to work through prescriptions
It's
and things
happening
of that
now,
sort.
yes.
And it's happening now, and it's
Yes.
going to happen more extensively.
Could have happened without this legislation.
Well,
Should have happened
well,
without this legislation.
But there's still 30 million people out there that aren't on Medicare or aren't on Medicaid that should be on some kind of a system, and that's where they come into play. And that's why we have so many of it.
So we turned a system that was not perfect, but working upside down
Well, it
and
wasn't
inside
working
out
if it
to
wasn't
accommodate
serving
30 million people.
Well, if it
Most of whom are not going to be accommodated anyway, again, if you
sure,
read
well, I think
some of the
we'll,
more
we'll
recent
deal with.
statistics coming out.
Well, let's hopefully see what happens here, because the other part of that is this report, the economic and fiscal impact on Medicaid, came to me by way of the Pennsylvania Economy League, talks about the analysis of what's going to happen here. In 2016, as an example, 3.3 billion in new spending will support over 34,000 new jobs, 5.3 billion in economic activity. That money will be moved around in such a way that it will multiply. 3 billion in gross domestic product, which I talked about earlier, and 1.8 billion in employee earnings. So that would be that year. And then if you fast forward to 2022, and I'll use that date for a good reason, I'll go back over it, almost 43,000 jobs will be created that year, in addition to the jobs that have already been created. 7.3 billion in economic activity, 4.4 billion in the gross domestic product, and 2.6 billion in employee earnings. That's a lot of numbers, yet it does say to us that the money that's going into that infusion might help us deal with what we've been worried about since the middle of '07 to the middle of '12, beginning of '13. We've had a lot of people unemployed.
Right.
We need to get people trained and into the system. The biggest employer in the Delaware Valley area is obviously the healthcare field. We have more doctors, more nurses, more people working throughout the hospital system. 1 out of every 5 employee in the Delaware Valley area works for a hospital. That's a major, major number.
Yes.
So we really have to look at that. And then in the suburban market, we have similar situations. We have one of the finest systems out here in the mainline health system, where we have Bryn Mawr Hospital, Lankenau, Paoli, Bryn Mawr Rehab, and we have, as you all of us do know, throughout Delaware County and Chester County, we have Crozier Keystone, we have Mercy Hospital, and the rest of those. Those people really are going to make it possible for us to be the prototype for this, what goes on here, because they represent Philadelphia, and out here on the main line, we're going to see the impact out here as well as everybody else. And we'll see earlier rather than later what's happening.
I'm not sure I understand. What impact? You mean the job creation, the economic impact?
And the number of infusions of 540 plus thousand people over a period of time. They won't all come in at one door. You're not going to open up the door and there they are. And in addition to that, once they do come on, if they don't need health care right away, they may need it down the road, and we'll look at what happens there.
It all sounds great, but is it sustainable? You used that word, I think.
Well, we're worried about that,
Yes.
and what we have to do is keep an eye on it. But then it seems to me that those unemployed numbers and those people who are being employed will put them on payrolls, and they will go off Medicaid, and Medicare will be
do you have any
the
data
other.
on what kinds of jobs, those 340,000 jobs?
I
or there were
don't have that
34,000? I've forgotten the number.
no, I don't think they put that in there.
Isn't it likely that they are low-paying jobs, service jobs?
I don't know.
Isn't it likely?
Well,
Isn't that where most of the
You know, it's
workforce in
interesting
healthcare
because the
is?
healthcare foundations funded this. There's like 30 of them in the state of Pennsylvania,
Right.
including the Blue Cross plans. So it would seem to me that they have a direct interest in having jobs for people in healthcare. And a lot of people have gone into healthcare in the last couple of years. A lot of new nurses.
It's been the only place to go.
It's really, but
Yeah.
it's the only one that's been funded properly
Yeah.
anyway, in some respects. And we hope that this will be funded properly too, and it won't be abused. It is 3 years old. It hasn't been fully implemented. It will be implemented in 2014 fully, and we will move forward from there, hopefully. And we hope that it will have an impact on the unemployment number in Pennsylvania and other states. The governor himself is not so sure. He's been
On the
holding this
Medicaid
up.
side,
Yeah.
yes.
So the,
But why? Why is he not so sure?
Well-
and others like him, governors of other states.
Here's the program indicates that for the first 3 years
Right.
on the Medicaid side, all the people coming into Medicaid will be underwritten 100% by the federal government. That's year 14.
AKA the taxpayers.
The taxpayers.
Right.
14, 15, and 16. That's 2014, 2015, 2016. Then after that, for the next 3 years,
Right.
the state will pay 5% of the total cost, and the federal government will pay 95%. That's 17, 18, and 19. And then in year 2020, the federal government will pay 90%, and the state will pay 10%. And we will move forward. That front-end load is worth about $5 billion of extra stimulus to the economy of Pennsylvania. It's equivalent to, if not more, than the natural gas program that we did here, that now is everybody's capping everybody's well.
Yes.
So they're not doing anything because the price of natural gas is so low. This will energize our healthcare system. It'll energize our economy. And I think from that standpoint, I see it as a good thing. It's a difficult thing. I see, will there be long lines? Will there be issues determining who gets what
Yes.
and how fast they get it? What will happen to the other doctors who stay out of the system? Some of them want to go into a concierge
Yes.
type of
Right.
business and charge a hell of a lot more than they are charging today. So we'll see where all that goes. In the meantime, people need care in the state of Pennsylvania to the tune of at least a 500,000 people. So we've got to figure out what we're going to do for those people on Medicare and Medicaid so they can get into the system that they aren't getting into now. Some of them are working poor, 133%
Yes.
salary. That's just that
Yes.
you can't live off that and pay for your health insurance too. So we have a lot of things here that we have to do, and I do hope that we will get the right kind of support from the Commonwealth, so that it won't be, let's argue about the Republicans and the Democrats, because we're going to do that anyway. But in the meantime, if we enter this program, I think the economic and fiscal impact of Medicaid that the Pennsylvania Economy League's report did, and they just released that, and I just got a copy of it the day before yesterday, which was over the weekend.
Yes.
So it's amazing to me that that hadn't been released earlier, but it does say an awful lot about the stimulus that it does imply and that it does create. And since healthcare is such a dominant player here, I mean, I didn't even mention the senior care stuff that includes the nursing homes and the
Yes.
continuing care retirement communities and the home health care that we have and things of that sort, which would be our Medicaid. How is this all going to impact us out here is in all of those pieces that are going to impact the city of Philadelphia as well as us out here. We're going to have a lot of new people in the system working, employed, and we're going to have a lot of more people coming to the doctor's door, knocking on that door or knocking on that hospital door.
You're making it sound wonderful, nirvana.
Well, I'm not saying it's nirvana. I
Well,
wouldn't say that.
it sure sounds that way.
Well, you know.
But what about the flip side? Medicare, for example. Your premium and my premium are going to go up considerably.
I think possibly.
Considerably.
Well, it's
no,
going to
not
go
possibly.
up.
Those are the projections. You got a letter, didn't you get a letter? I got a letter that said,
I didn't get that
well,
letter.
you didn't get that. I'll
I
send you
heard
my
about
copy. That the premiums are going to go up to Oh, sure, I don't remember exactly what it was, but it went from, I mean, it was a significant jump based on income, the monthly premium for Medicare. Yeah, for Medicare.
Well,
You don't hear much about that.
no, you don't. But
Now, that means that people who are already strapped, living on fixed incomes, may not be able to afford the Medicare premium.
and then also the people.
Are they then
who are
eligible for a
not-
subsidy?
I'm not aware of
I don't
one.
think so.
I'm not aware of that. And
So how can you continue, which is what this does, takes out of one pocket to put in another pocket?
well, I'll show you
And,
the other.
and what's going in one pocket is borrowed money we don't have that's contributing to the deficit in our national debt.
Well, we have that money because.
Oh, because we keep printing it, yes.
Well, I don't know if that's the reason we have it.
What other reason
People
can
are
there be?
coming back into the
But
economy.
even with the
and they're
rosiest,
working.
even with the rosiest predictions of a recovery in the economy, including creating jobs, even the president's experts are talking about $3 trillion, $22 trillion by the end of his presidency.
Well, that was not just his presidency. This former president. So we
To
have
the
some
extent
of
that previous presidents have contributed to
Yeah.
it, you're absolutely right. Not at this rate, and not in such a short period of time.
but they didn't create
He
jobs,
came in-
and this is
he came in
creating
at eight-
jobs.
He came
too.
in at 8 million, I think it was, or 7 million.
I
And
think
the,
it was
at the end of
more,
his
yeah.
2-year term, I believe the projection
1
is
year.
it'll be over 20 trillion.
Trillion. 8 trillion is it?
Shouldn't somebody care about that? Yeah, we may be able, in theory, to provide all of these wonderful benefits, fix all of these problems, but at what cost? And in the long run, how can it benefit anybody to have a system fall in on itself?
Well, I don't think that the healthcare system is going to fold into itself because I think we've got some bright people here, and this medical system that we have here
Yeah.
in the Delaware Valley area
But it's-
is far superior.
It's
to
not
others.
operating in isolation. It's still dependent on everything you've been discussing.
Well, I think that we're going to stop. We're going to see that
Hmm.
it's going to create jobs, and those jobs are going to create other jobs because the people that get the jobs
Yes.
are going to spend money.
That's the way
so
it's
there's
supposed to
synergy,
work.
and
Right.
that's the way it's supposed to work,
Right.
and hopefully it will work that way. And we're not counting on it to be something that's a giveaway. It's going to energize the system, and I think that's extremely important. You can't find $5 extra billion for the Commonwealth of Pennsylvania in the first 2 or 3 years of this system, and not say, boy, that's not going to be an impact.
That's assuming the Commonwealth buys into
Well, the Commonwealth,
Medicaid.
if the Commonwealth doesn't buy into it, they're going to do that anyway, and they're going to pay 100% of it. They being the federal government, they will underwrite the whole package if they have to. It's in the best interest of the Commonwealth to pay for some of that, but we'll see what will happen.
Yeah.
But in the first 2 years, they won't get that front end money. The federal government will operate doing that, using that money. And there goes $5 billion that we don't see that much of. It's not too unsimilar to what we're talking about when we talk about the energy situation with the natural gas.
Yeah.
Well, they were looking for all that, and then boom, they're capping all of it now. And they're not. And right now, the deficit doesn't look too good for the Commonwealth either. And I worry about that.
Because they turn off the revenue
Yeah,
spigot.
they turned off
the industry
revenue.
has turned
The
off
industry
the revenue.
has done that, which is strange, but it's not. If you think of what they're saying, is well, why should I get $350 for this when I could wait until you use less of
It's
it,
the
more of it?
free enterprise
Supply,
system, isn't it?
well,
And that's supposed to
supply
be,
and demand.
Yep.
And I think we need
that's
it.
how this legislation has been described, being market driven.
And I think it's market needed driven. And when you think about all those people, 30 million people not having any coverage, and then
Boy, John,
they can't continue to go through the emergency room.
It's impossible to disagree with you on that point. I can't come to your side on, and I'm not talking politically, ideologically, and having confidence and faith in the government. Again, you've been in this business for a long time. You've seen all the changes that have occurred. How can you have confidence in turning over 16% going to 22% of our national gross product over to a government that has not been able to walk and chew gum at the same time? Not just this administration.
Well,
Any administration.
For the last 2 years, you've seen the business of the healthcare system stabilize somewhat and actually go down in a couple cases. And that was an indicator that it
We're talking about
potentially-
cost? Cost.
And they did go down. Now, that's not saying that they went down because they drove some things, but there were some things that were done that stabilized the country.
Yeah, including the fact that people didn't have enough money to go to the doctor
No,
and pay for their out-of-pocket
and that
expenses.
Medicare recipients saved $750 on their prescriptions, as an example. I used to work for a pharmaceutical firm, so I had to go dig for that one, but I found it. But then I worked for doctors for a couple of years too, the Medical Society in Philadelphia, and also for Blue Cross. And in the process of working for Blue Cross for the 8 years before I opened my own firm, I found that we were raising prices in the 80s, 30% a year, and it's not a sustainable system to do that.
Agreed.
And we were saying that then, and fortunately, we had some people come in like Dennenberg to say, we really have to stop some of this, and they blamed it on us when it was dramatic increases in healthcare costs.
Well, again, I wish I could believe.
I think
all of the numbers, all the projections, all of the rosy prognostications about not only better health care for more people, but the economic impact, job creation, et cetera, et cetera. We've been through, you're the first person I have heard say that one of the real benefits of this legislation is job creation.
Yeah.
I haven't heard that very often before. I didn't realize that job creation was one of the objectives of the Affordable Care Act.
Well,
I thought it was to fix our health care.
And here comes an outside advisors talking to the state of Pennsylvania's healthcare foundations, saying that, hey, we're going to have additional 34,000 jobs in 2016 and another
as a result of
43,000.
as a result of a system that a number of experts say is not sustainable.
Well, no, the system itself.
No, I mean this legislation and all that it imposes is not sustainable. The money isn't there.
Well, the money is there, and they will be able. And we are growing, and the tax base is coming back, and more people are getting employed, and hopefully the system will continue to grow. The system, I'm talking about the country now, and we will have more people employed, as indicated by some of these statistics, which will be synergistic to other things that are going on.
Anything else you found in digging through the
what I
legislation?
didn't find out, and I wanted to find out, and maybe I'll come back someday in the future when we have time, is to talk about what's going on with the business community and the impact this has on them. Not only the economic impact on their employees, but on them.
Give me one salient comment on that in the time we have left.
Well, it's about half of the entire spending cycle of the $2.8 trillion in the country is spent by employed people through their employers who have always found ways to find good health care programs for their employees. The cost may rise for that, and we have to see it. We have to see what that means. And all the data isn't in yet. I haven't seen enough of it to bring it to this table today because I thought it would cost too much.
I think in the minute or so we have left, this is complicated. It is transformational, and change is hard.
Always for all of us.
All of us. Nobody likes change.
Especially guys like you and me.
Well, you would think we'd learned a lesson.
We have learned some.
We're all hopeful that it has to work. But if it doesn't, we're going to be worse off than we were before the introduction of this bill.
Well, maybe we can get Congress to do some work then to keep a close eye on it and make sure that it works.
Well, we'll see.
Okay.
I hope you're right. I truly do. I hope you're right.
Thank you, Rick.
I wish I had more confidence in it.
Well, I have enough confidence for the both of us at this stage.
All right. This is 30 Minutes. I'm Rick Anthony. Check this out. Learn. Educate yourselves. Your point.
Extremely
that is
important.
our first obligation to ourselves.
And better healthcare habits, too, might be a big help, too.
Until next time, take very good care of yourself.